watching NBC4, live from the area's leading news station. This is News 4 Midday.
All morning, we have been getting a lot of phone calls and a lot of emails with questions that you have about this virus.
Earlier this morning, Kimberly Souters put those questions to Dr. Thomas Gaiter of Howard University.
Well, we're in the newsroom because all morning you've been sending us your emails, you've been calling in with your questions about swine flu. Fortunately, we have an expert here in the medical field, Dr. Thomas Gaiter. Dr. Gaiter, how is the swine flu different from the typical flu, which does kill thousands of people every year?
Well, you're absolutely right. The typical seasonal flu does indeed kill thousands of people. But one significant difference is that we have a vaccine. With this particular swine flu, we do not have a vaccine, so the immunity is not there.
What about allergies? A lot of people are suffering from coughs, colds, sore throat, even exhaustion. How do you tell the difference between that and swine flu symptoms?
And allergies, this is a bad time of the year. The symptom is a little bit different in that one has fever, body malaise.
How long is the incubation period if you're not exhibiting any symptoms?
Incubation period is about 1 to 4 days.
A lot of people are traveling, planning to travel, have come back from travel.
There's a CDC advisory against non-essential travel to Mexico, and that CDC advisory should be followed.
What about traveling around the country?
Traveling around the country, there's no recommendation at this point to travel to California versus Idaho, so that one can travel around the country. But the thing to remember is to take every step to be careful and the precautions that are necessary, such as hand hygiene. So very, very important.
What about wearing the medical masks and taking Tamiflu with you if you do have to travel to a place like Mexico?
You cannot be too careful. So if one does indeed have essential travel that one needs to go to these places, then a mask is helpful. Hand sanitizer is helpful.
Some people are writing in saying, come on people, this isn't that big of a deal. It's just a flu. It's going to pass over. The media is blowing this out of proportion. How do you respond to that?
Well, it is a big deal for us. Certainly that this should be taken very seriously. And as you well know, the World Health Organization has increased their alert as it relates to this, almost to pandemic stage. We're at stage 5 now. If we need to limit this like we know we do, then staying at home is the thing to do. So follow that recommendation, please.
There's your doctor's note. Okay, reporting from the newsroom, I'm Kimberly Souters, News 4. Now back to you.